Thank you, Sharon, and thanks everyone for joining today. As usual, I will present a brief summary of where we're at in the outbreak, information about the vaccination program, and then take your questions. We continue to ride a COVID roller coaster, and we're currently going down, which is gratifying, but we continue to see high levels of COVID-19. After 2.5 months of rising cases that began in September, our COVID-19 case reports peaked on December the 5th with 770 new cases daily. And since then, we've been decreasing throughout most of December, rose again for 2 weeks after the Christmas holidays, and have now been falling since January 9th. Over the past 7 days, we've reported approximately 360 new cases daily. And see, the incidence remains highest in the cities in South King County, particularly Auburn, Kent, and Federal Way. Hospitalizations and deaths have also been decreasing currently, which is welcome news. Over the last full week, 120 COVID-19 cases were admitted to King County hospitals, and about 5 people died each day of COVID-19. Approximately 2/3 of deaths have been in the 75 and older age group, and about 20% in the 65 to 74 age group. Another recent trend is that since the holidays, we've noticed fewer people are seeking testing. And I want to take a moment to remind people how important testing is to limit the spread of infection to others. If you have symptoms of COVID-19 or you've had close contact with someone who's ill, please isolate away from others and get tested. And you can do that through your own healthcare provider or at one of our free testing sites in King County. It's key, though, to isolate from others as soon as you feel sick and while you're waiting for your test results. Now, I'm going to speak a little bit about the variant strains. It's about a year since the first case of COVID-19 in the US was recognized in neighboring Snohomish County. And when it appeared suddenly about a month later in King County at long-term care facilities and other locations, we learned that the virus had been spreading undetected for weeks. Now, a year later, we know that a more contagious variant strain of COVID-19 has been spreading in at least 20 states, and the variant of concern will likely be found locally any day now. Now, we are used to living with real volcanoes in the Pacific Northwest. And right now, we're also living in the shadow of a COVID-19 volcano. And we need to expect the coronavirus equivalent of a Mount St. Helens-like eruption at some time in the next few months. That's because a more transmissible strain can cause a viral eruption in infections, hospitalizations, and deaths that can overwhelm our hospitals. This virus has been working out. It's gotten faster and more fit. And we need to fight smarter and harder to beat it. But we can and must beat it down. These variant strains spread from person to person the same way as other strains, primarily through the air we breathe, but they're better at it. That means if you're exposed to someone with COVID-19, you'll be more likely to catch it, and people with COVID-19 will be more likely to spread it to more people more quickly. So I want to be clear that we should expect the variant strains to become widespread here, and that will make the outbreak harder for us to control. But we have the advantage of early warning to help us prepare. What can we do? The same familiar COVID-19 prevention strategies can work against variant strains, but we need to be better at them. Remember that COVID-19 spreads mainly through the air, either by close contact or when it builds up indoors over time when the ventilation is not good. To stop the spread, we should take a very fresh look at how we can do better in taking all possible precautions in our personal and social lives, in workplaces, and wherever people gather. This means decreasing non-essential activities outside the home. Wear a well-made, and that means 2 layers or more, snug-fitting mask whenever around people from outside your household. Improve ventilation indoors and in workplaces. Avoid crowded indoor spaces and places with poor ventilation as much as possible. And socialize and do as much as possible outdoors. Keep 6 feet of distance at a minimum, especially indoors, and wash hands frequently. And finally, remember that you can't tell who has COVID-19 from looking at them. COVID-19 can spread from your friend, your coworker, or your family member, anyone before they look or feel ill. So always take precautions. Now, vaccines are an important part of our defense once enough of us are vaccinated, but they cannot be our only defense. Vaccines are a light at the end of the tunnel, but the tunnel has gotten a bit longer and we're still in it. Now, I'll pivot and share a little bit of information about where we're at with our vaccine program. In King County, there have been over 137,000 doses of vaccine administered as of yesterday. And as you remember, in mid-December, we entered phase 1A, which is about 140 to 180,000 frontline healthcare personnel and an additional 40,000 or so long-term care facility residents and staff. And this is the highest number of people eligible in that phase in the state of Washington. We're now in phase 1B1, which are adults over 65 years of age and older, which is approximately another 300,000, with additional persons 58 years of age and older that cannot live independently and are in multi-generational households. We've had 214,000 doses allocated to King County, which is about a quarter of the state's allocation. And that doesn't include the federal pharmacy partnership allocations to long-term care facilities. We have administered at least 2/3 of those doses very rapidly after they've been received. This number that we count of 2/3 is likely an underestimate because some doses are needed in inventory each week for upcoming appointments. Some doses are administered to non-King County residents, and some doses are administered but not yet entered into the immunization information system that allows us to track doses administered. For example, we've made good progress in vaccinating our eligible licensed healthcare providers in King County. So for example, 80% of nurses, 81% of physician assistants, and 74% of physicians have received at least one dose. 65% of our emergency medical techs and paramedics, 65% of dentists, and 56% of pharmacists have received at least one dose. Unfortunately, only about 37% of our licensed healthcare assistants, such as medical assistants and other licensed technicians, have been vaccinated, and we're encouraging them to come forward and seek vaccination. But our main challenge now is not enough vaccine. It persists to be the main roadblock in rolling out vaccination more quickly to more people. We don't know week to week what to expect, and we cannot forecast future allocations. For example, our weekly allocations have ranged between 12,000 and 73,000 doses. And yesterday, the Department of Health let us know, and let all enrolled vaccinators know, that Washington State is still receiving very limited doses of vaccine, and that our allocation as a state doesn't line up with current needs. Despite that, through this week, the average number of doses administered has increased each day in King County. It's increased over the past week about 25%, from 5,400 to 6,800 doses per day. But we expect that to change if our allocations do not increase accordingly. So this limited supply plus the inability to predict what's coming makes planning for all of our vaccinators, especially the high volume sites, terribly challenging. For example, as I mentioned, we have over 300 newly eligible for vaccine in King County during phase 1B1, and we received 38,000 first doses this week. That's enough for only 1 in 8 of the eligible. Now, we always knew that the COVID vaccination program would take many months, and yesterday, in a national briefing, Dr. Fauci estimated that under the most favorable conditions, the US might be able to vaccinate all eligible adults by the end of the summer. So we all have to understand what's realistic based on the number of doses that the current manufacturers are able to supply and that the US government has purchased. Now, we've developed a very robust six-pronged plan with partners in the healthcare system, community-based organizations, private sector businesses, and governmental partners. Many features also were incorporated into the Washington State plan, but it depends on having enough doses. So given the limited supply, we're using the vaccine that is allocated to our department to address inequities in vaccine access, focusing our efforts on those who don't have a relationship with a doctor or the healthcare system, or don't have easy access to the healthcare system. And we're setting up sites to reach older adults in communities that have been disproportionately impacted by COVID-19. We've coordinated with our partners and local fire departments to reach high-risk adults, including the staff and residents of adult family homes and vulnerable older adults living in low-income senior housing and permanent supportive housing. So these efforts are underway, and we look forward to continuing them when supply and as supply permits. As you know, we're planning to open high-volume sites in the beginning of February, focused on reaching those who are disconnected from the healthcare system or who have difficulty accessing healthcare. And we really are looking forward to having increasing numbers of doses over time to provide access to as many people who are eligible and who are willing to be vaccinated as possible. So these sites will start ideally with being able to vaccinate 500 people a day, and they would be able to vaccinate thousands a day if supplies were adequate. With that, I think I'll stop and be happy to take your questions.
Thank you very much, Dr. Duchin. Let's see, let's start with Nick Popham. You are unmuted.
Hi there, Dr. Duchin. Thanks so much, as always, for taking some time out for us. It's Nick Popham with Como TV. I was wondering if, I know Fauci yesterday you had said that, favorable conditions will most likely take until the end of the summer for most of us to get vaccinated. Do you think the change in federal leadership might speed that up at all, though, and whether using the Defense Production Act to revamp some of these delivery systems or how we build the infrastructure? Do you think it'll speed up at all, or are we supposed to just expect that we're going to continue with this limited delivery and limited capacity?
Well, I think Dr. Fauci was opining based on the best information that he had at the time. I do know that the administration is looking very carefully at what the national vaccine supply situation is and what they can realistically be able to forecast. So I think over the coming days, we'll have a more realistic expectation of whether that timeline can be shortened or it will be longer than we anticipate currently. I think it can be sped up theoretically. The new administration has talked about invoking the Defense Production Act, that they could do things like produce more syringes that would allow 20% more doses potentially from the Pfizer vaccine, that vials seem to be overfilled, and allow extra doses to be drawn out if adequate syringes are available. And there's always the possibility of new purchase agreements. I do know that the administration is highly committed to getting as many doses out as possible. So, but I can't forecast how successful they'll be. I mean, I think we all have to understand that a immunization and vaccine production enterprise of this magnitude is inevitably going to have problems, bumps unforeseen along the way. There'll be supply issues. There may be vaccine safety issues that cause pauses as they're evaluated. There may be issues related to demand for vaccine. We're anticipating our timelines, assuming that many people will come forward for vaccines as they're available. And so far, I've been very gratified. I shared with you some of the very high numbers of our healthcare workers, high proportions that have come forward for vaccination. And I hope we continue to see high demand for vaccine as it becomes available throughout all cross sections of the population. But it is a bit unpredictable. So as we have more opportunities to offer vaccine, we'll have more information about what the uptake will be. but I can't predict, with certainty, and no one can really, the ultimate timeline. All I can say is we knew from the get-go it was going to be an operation that would take 6 to 8 months, and we very much would have liked it to have started off more quickly, and would like to see it continue to expand as quickly as possible. But at this point, we're still struggling to know what's realistic to expect over the next weeks to months.
Thank you. While additional media are asking their questions, let me share with you a few from Facebook. One question here saying that there are rumors floating around about doses being discarded, and that seems very upsetting given the need. Can you explain anything you know about this, and is it true?
We have not heard of doses being discarded. We do know that at the end of the day, sometimes there are patients that didn't come for an appointment, or there are some of these vials that had extra doses in them. And we encourage our healthcare vaccinators, our partners, and certainly what we do at our sites in public health, and what we encourage all of our partners in the community to do, is to have a list of eligible people that they can rapidly call up for vaccination if they have doses at the end of the day, unanticipated extra doses. So those doses ideally will go also to people who are eligible but who couldn't get an appointment on that day, so that someone who can benefit from vaccine and who's at high risk can be protected. We don't want to see vaccine doses wasted, and I certainly hope that isn't happening to any great extent. I imagine sometimes it's just inevitable. You may have one or two that you can't find someone on site at the time they expire, but we certainly want to avoid that as much as possible.
Thank you. Another question here from the community is there any way to prioritize the oldest people within 1B? This is from a listener here. My father is in his 80s and can't seem to get an appointment.
Yes, that's an excellent question. As you know, the guidance from the Centers for Disease Control and Prevention started with older folks, and then extended vaccination to younger people over time. And I think, what we were anticipating, or what the state was anticipating when they issued the current 1B1 guidance, was not the shortage of vaccine that we're currently seeing. It makes this question much more relevant. For example, we know that people who are 85 and older are 630 times more likely to die from COVID-19 than someone who's 18 to 29. And someone who's 75 to 84 years old is 220 times more likely to die of COVID-19 than someone who's 18 to 29, while someone who's 65 to 74 is 90 times more likely. So you can see that the risk goes up very much with age, and the older age groups are at much higher risk, and successively as you come down, risk is lower. So it is a reasonable strategy if vaccinators have only a limited supply of vaccine to use it for those patients that they believe are at highest risk, and also to temper expectations and not to be overwhelmed with appointments, to limit the number of people who would be seeking vaccine, and then to the greatest extent possible offering to all who are currently eligible. But at this point in Washington State, the guidance from the state is that anyone 65 and older is eligible. So how in practice our healthcare colleagues and others will manage the overwhelming demand may be to, within their populations, preferentially offer to the older folks first, because they are at the highest risk. But that is not currently part of the official guidance.
Thank you. And it looks like Jeff Pajola, you are unmuted. Let's give Jeff another moment.
There we go. I had to click on the button. I guess this is Jeff with Como Radio. My question, I suppose, is we know that at least with the Pfizer and Moderna vaccines, you need 2 doses. How are we guaranteeing that people, particularly in these most risky age groups, they get their first dose, but then are coming back to get their second dose. I guess the question would be better described as how are we guaranteeing that they're able to get that second dose? Are they higher priority? Are they on a list? How does that work?
Yeah, thanks for the question. Very important one, because we know full protection requires 2 doses, and we want to get that second dose in as close to the scheduled time with respect to whichever vaccine, 21 or 28 days, as possible. I do want to just start by saying it's not it's not a big problem. It's not going to be long-term issue with protection if your dose is delayed by a matter of weeks. That is perfectly acceptable, but a small, not a long delay. And I believe we'll be seeing some guidance from the CDC coming out specifying that shortly. But we do want to get them as close as possible to those scheduled recommended dates. And so when the state health department, is responsible for the ordering of the doses and the allocating to the local health jurisdictions and the vaccinators directly, and they are accounting for the number of first doses through our immunization information system. They know how many people have been vaccinated. They know when second doses are due, and they are allocating vaccine to those vaccinators who have patients due for second doses based on the information in the immunization information system. So there should be of doses available for everyone who had a first dose as long as supply permits. Now, if we see that the number of doses required for second doses is increasing so dramatically, as it increases, what I should say is as the number of second doses that are needed increases, that may impact our ability to offer first doses, because we may need to, the priority at this point will be to complete the vaccination series. So again, once we have more information from the federal government and hopefully a more reliable supply and the ability to forecast, we'll be able to answer this question more precisely about how many first doses versus second doses, we'll be able to administer. But the priority currently is to make sure people get their second doses.
Thank you. And Glenn Farley, you're unmuted.
Hi, can you hear me?
Yes, go ahead.
Perfect. So there was a bunch of information that came out yesterday from Virginia Mason, also from the governor. He cited 20 Costco sites that were apparently going to give doses. So other than the communities you cite, the mass vaccination centers you may set up next month, where in King County can anybody who qualifies get a dose now?
Yeah, the best place, the only place that information is currently available is on the Phase Finder, and it varies, from minute to minute based on how many appointments are available and how they get filled up. So I will just say in general, our hospitals are all vaccinators, our major hospitals and their healthcare systems. So throughout their clinic systems, many hospitals are offering vaccination. For instance, UW, Swedish, Virginia Mason, as you mentioned, CHI Franciscan, and others, Kaiser Permanente. Many of our community health centers are offering vaccination, and our public health sites are offering limited vaccination. We're giving second doses to those people that we provided first doses to. There are also our pharmacies in the community that are offering vaccination. I don't have a list of those handy, but we may be able to provide that to you after the conference. The Phase Finder is the place, and I know it's very frustrating and hard to use the Phase Finder right now, but that's in Washington State. That's the tool that's been developed to help people understand whether they're eligible and where they might find vaccine. We are working to create a better system for King County residents, including a phone-based system, particularly for those folks who don't use the internet or who don't speak English and might need help understanding where they can access vaccine in their community. In addition to those sites where people can go-to for vaccination. We are working with our regional EMS fire partners, Seattle Fire, Bellevue Fire, Puget Sound Regional Fire Authority, who are going to adult family homes and supported living to deliver vaccines to those high-risk, vulnerable populations that have access, that have issues accessing fixed sites.
Thank you. And Jessamine McIntyre, you're unmuted.
Hi, Dr. Duchin. Thank you again. Jessamine McIntyre with Q13 Fox. I was going to ask more about the mobile vaccination teams. I know they're reaching the most vulnerable parts of the community right now. Is there any plan to expand those to, once you feel as though a large portion of that population has been vaccinated, to expand and continue the mobile distribution of vaccinations?
Yeah, thanks for the question. We have plans to enhance almost every aspect of the vaccine delivery business as doses become available. So as I mentioned earlier, we are planning for 2 high throughput sites, large volume sites in South King County. We're also planning for additional mobile sites as vaccine supplies become available to reach those populations who can't access vaccine, either homebound or congregate settings. And also for community-based pop-up clinics for those areas where we know they're disproportionately impacted with higher rates of COVID hospitalizations and deaths, but to have fewer healthcare system resources, and ultimately even employer-based, workplace-based that will offer both to the community surrounding that workplace, but also potentially to the employees if they're eligible. So we do have this multi-pronged strategy that we're waiting to stand up that is based on having doses available. And unfortunately, we have over 300 vaccine providers now in King County who have signed up to deliver vaccine. Now, not all of them have been able to get vaccine from the state because of the limited supply. And we're faced with this problem now of stagnant or even decreasing supply potentially, more vaccinators, and at the same time, the need to stand up some of these high throughput sites for those communities that don't have good access because of where they're located and their rates of disease are so high. So it's a very terrible planning situation, very challenging for us and for all the vaccinators at the moment. But we are hoping to enhance not only mobile, but many other elements of our vaccine delivery system as soon as supplies allow.
Great. And before we wrap up, I think Nick Popham, you had one follow-up question. Let's try and get that in.
Awesome. Thank you so much. Again, in your initial remarks, you mentioned a Mount St. Helen-like eruption of cases with this new variant potentially. Does that mean moving to phase 2 is most likely going to be a long shot? Because I think DOH said today that everyone's staying in phase 1 again. Obviously, numbers are going down right now. We're on a trajectory of doing so. But with this new variant, like you said, there's a good chance it could shoot right back up. Is phase 2 a long shot? I guess is my short form.
Well, yeah, it might be. I mean, there's a couple of things. First of all, the phase determination from today is based on a couple of weeks ago, our patterns through the end of December. And we were largely rising at that point. But since then, as I mentioned, since early January, we've started to come down. So our recent trends, if we continue them, will put us on a path towards moving forward. If we continue to decrease our case incidence and our hospitalizations continue to fall. The new variant will be here. It's going to cause lots of problems when it gets here. It's going to make the outbreak harder to control when it gets here. And so what we need to do right now is to continue to stomp this virus to the lowest possible levels by getting good, getting better, being perfect at our COVID-19 prevention measures. And that will allow us to continue to move forward. It's really the extent of our compliance with the distancing, limiting activities, good quality face mask wearing, and avoiding, the improving ventilation, avoiding crowded indoor air spaces where others gather. This virus moves from person to person. It's, we know how to stop it, but we have to do that. And if we do that, we can continue to see our levels decrease. Now, again, the new variant will make it harder. And I can't predict whether we'll be successful or not. I hope we will be. but it may require, more rigorous mitigation measures than we currently have if it starts to take off like it did in the UK, like it's doing in LA, or I should say like what is happening in LA. It's still not clear how much of that is due to variant strains or not, but they are certainly having a problem that is requiring extreme measures to control with respect to the stress on their healthcare system and the large numbers of lives that are being lost. We don't want to see that here. And the way to avoid that is by suppressing the transmission of the virus to the lowest possible levels before the variant arrives. Very difficult to play catch up once it gets momentum. So we can continue to move forward if we do everything possible to prevent transmission of this virus right now and use the methods that have been working in the past. I can't predict exactly what will happen with a new variant. I can't predict exactly when it will arrive, but I'm confident that it will, and when it will, it's going to be trouble. So we need to really do all we can to minimize the amount of trouble that it will cause, to minimize the pain that it will cause us, and to get the transmission under control now before that might happen.
Thank you. And anything else to add? Dr. Duchin, you had a good wrap up there.
Yeah, no, I don't think so. I mean, really, this is no time to relax or slack off or to rejoice over our falling numbers. I mean, it's gratifying. Certainly, we should all be grateful when we see fewer people hospitalized and fewer people dying. But we can't take anything for granted. We have to remember that this virus is lurking, it's getting better, and we need to be prepared for, a tremendous challenge over the next few months until our vaccination program is able to offer vaccine to enough people that will help us slow the virus even further. And if we're lucky, by fall, according to the feds currently, our lives will be much, much better than they are now with respect to getting back to our activities. But if we don't heed the warnings, if we don't take the variant seriously and the challenge seriously, and if we don't have enough people ultimately vaccinated, we may not see that return to what we want to see as quickly as we otherwise might.